There are many things that individuals need to know before working within a healthcare setting. One of these things is infection control. This will not only help keep you safe, but will also keep the individuals you work with safe as well. Before we talk about how you control infections in these settings, there's a few things you need to know. There are 3 ingredients needed to pass along infections in these settings. One is a source of infectious agent. The other is a mode of transmission for the infection to spread. And lastly, a susceptible host. There are also 3 forms of infection transmission. These can include contact, droplet, and airborne. So how can you prevent the spread of infection within a medical setting? Let's talk about that. There are 7 forms of universal or standard precautions that can be applied to all people within a healthcare setting. These precautions include hand hygiene, use of facial protection, appropriate device handling, respiratory hygiene, appropriate use of gloves, appropriate use of masks, gowns, and aprons, and appropriate handling of laundry. These will apply to all individuals within the healthcare setting. One of the specific precautions was hand hygiene, which can be accomplished through hand washing, which includes 12 steps. What you'll need is a sink, hand soap of your choice, and some disposable paper towels. Let's get started. To start off, you will want to wet both of your hands with warm water. From there, you will want to apply enough soap to cover all surfaces of your hands and begin rubbing your palms together. Then take your right palm and rub it over the back of your left hand with interlaced fingers. Copy this action on the other hand as well. Next, rub your palms together with fingers interlaced. Do this for about 10 seconds. Next, rub the backs of your fingers to the opposing palm with your fingers interlocked. Make sure your fingers on your left and right hand are both being scrubbed. Next, rub your left thumb with your right palm in a rotational back and forth motion. Make sure that you do it on the other thumb as well. Lastly, do a rotational back and forth scrubbing motion with your clasped fingers within the palms of your hands. Now it's time to rinse your hands. Grab a disposable paper towel and thoroughly dry your hands. Then use that towel to turn off the faucet. And that's it. Now your hands are safe and clean. There are 5 moments you should be aware of in which hand washing should occur before and after. This can include before touching a patient, before clean aseptic procedures, after body fluid exposure or risk, after touching a patient, and after touching a patient's surroundings. With this new information, you can make choices within the healthcare setting that create a safe and clean environment for the individuals that you interact with, and will also help control the spread of infection. Thanks for watching.